Let us look at oral cancer. Oral cancer occurs inside and around the mouth. To understand how it happens, let us first look at all the different areas that can be affected by oral cancer. Oral cancer may affect the tongue, the roof and back of the mouth, the cheeks, jaws, and all the area around the mouth. Are you at a risk of getting oral cancer? Let's find out. Tobacco in any form can make a person vulnerable to oral cancer. Hookah, cigarette, and BD, brushing with tobacco, chewing tobacco, khara or gutka, zarda pan. The consumption of alcohol of any kind increases the risk of oral cancers. Some signs may indicate the possibility of oral cancer. Let's see what these are. One of the signs of oral cancer is feeling pain when opening the mouth. In the beginning, it might only hurt to open the mouth fully. At later stages, it may become difficult to open the mouth at all. If you find small white or red patches or sores that may be difficult to heal, they might be a symptom of oral cancer. Screening is the process of catching an illness in its early stage. Let's see what the screening for oral cancer is like. You can screen yourself at home regularly. There are 8 steps of performing an oral self-exam. Step 1. Use your forefinger and thumb to stretch out the cheek. With a strong light illumination inside the mouth, check for white or red patches, sores, or swellings. Step 2. Check the other side of the mouth in the same way. Step 3. Stretch your upper lip with thumbs and forefingers of both hands. Check the inner folds of the lip as well as the upper gum for persistent red or white patch, sores, or swellings. Step 4. Stretch your lower lip with the thumbs and forefingers of both hands. Check the inner fold of the lip as well as the lower gum for persistent red or white patch, swellings, or sores. Step 5. Open your mouth as fully as you can. Roll your tongue back as much as possible. With the light illuminating the inside of your mouth, check for sores or swellings on the underside of your tongue. Step 6. Open your mouth fully as you can. Push out your tongue as much as possible. With the light illuminating the inside of your mouth, check both the front and back of your tongue for red and white patches, sores, or swellings. Step 7. Open your mouth fully as you can. Push out your tongue as shown. Check for red or white patches, sores, or swellings along the visible side of your tongue. Step 8. Repeat the examination for the other side of the tongue. Clinical screening. You should get a clinical exam every 2 years. There are some examinations that only a doctor or health worker can perform, such as feeling for lymph nodes in your neck. Treatment of oral cancer. Oral cancer is easy to treat, especially if detected early. If you do your self-exam and clinical exams regularly, oral cancer can be caught very early. The treatment for this is cheap, easy, and simple and the chances of full recovery are very high. If not detected early, surgery along with chemotherapy and radiotherapy might be needed. Sometimes the part of the affected area may have to be removed. If detected late, when the cancer has already spread, treatment is still possible. Doctors will treat you using various treatment modalities to reduce pain and suffering as much as they can. Is there a way to protect yourself from oral cancer? Yes, there are several. Prevention of oral cancer. One of the biggest preventive methods is to make sure that you do not consume tobacco in any form. One of the preventive methods is to make sure that you do not consume alcohol in any form. Along with that, try to eat things that are good for your health. Vegetables, fruits, dal, chapati, and rice should be what you eat the most. Fish, chicken, eggs, and milk are also good for you, but only if you eat them in moderation. What you should eat as little as possible is food that has a lot of oil, butter, or ghee, colas or fizzy drinks, sweets, and all kinds of fast food or fried snacks. Good oral hygiene. Use a clean toothbrush. When the bristles spread out too much, get a new one. Use a toothpaste that does not contain tobacco. Do not use tobacco cream or masheri for brushing. The best way to stay away from cancer is to catch and treat any signs or symptoms that may indicate cancer. And most importantly, don't ignore a symptom. Feeling pain when opening the mouth. If you discover for persistent red or white patch, sores or swellings, or any other symptoms of cancer, speak to your local health worker or doctor immediately. Remember, early detection saves lives. Choose good health and happiness. Stop smoking. Eat healthy. Screen yourself.